So thanks so much for the invitation. Really delighted to join you today. I would just like to, sorry, just trying to advance my slides. Great. I would just like to add my acknowledgement of country. I'm on Camaragal land today, and to note that Aboriginal people have been tremendous stewards of this land for more than 60,000 years, and that these themes of stewardship and care of country are particularly relevant to what we'll be talking about today. So I have three key messages for my talk today. The first one is that I think that a lot of people, a lot of health professionals think that climate change is important, but few of our colleagues realise how urgent and how serious it is. And it's now the case that delay is as dangerous as denial. And secondly, if we take a big picture view, and Nick has talked to this somewhat, if you look at this, we really have two key tasks ahead of the health system. Okay? We need to get to net zero. We need to mitigate. We need to stop being part of the problem, as Nick mentioned. But we're also going to need to be climate resilient. Right? Even if we stop polluting tomorrow, there are climate changes locked into the system, and we need to be, as a system, prepared and resilient for those. So I'll be talking today about sort of what we're doing on those two areas. Okay. So over the past few months, there have been a number of scientific reports published, obviously in the lead up to COP26, setting out the urgency and the seriousness of the situation, with the UN Secretary General describing this now as a code red for humanity. And in this case, the really important point is the urgency. We have now left this so late. We have ignored scientists' warnings for decades that we now need really decisive action to avoid catastrophic climate breakdown. Okay? As you can see in that headline there, the modelling suggests that in Australia, we need to get to net zero by about 2035, with most of that achieved by 2030, okay, to avoid catastrophic climate breakdown. So as in that headline there, we've got 10 years, basically got 10 years now to fix this. And of course, the climate crisis is not just an environmental crisis, it's a health crisis. Okay? And Australia is one of the countries on the front lines of climate health impacts. Okay? So as a system, we will need to be prepared for extreme heat, for bushfires, for storms, floods, droughts, for rising rates in allergens, shifts in infectious diseases, mental health impacts, and so on. And not just the impacts on our patients and our communities, but also thinking about the impacts on our workforce, our infrastructure, and indeed our supply chains. Okay? So that is an enormous task. And whilst there's a whole range of things to be prepared for most metropolitan populations in Australia, the number one climate health impact is extreme heat. Okay? The health professionals and systems will need to work alongside urban designers, transport, community groups, councils, and so on in preparing for extreme heat, and in particular for protecting the most vulnerable in society. So we have a big task ahead of us in terms of adaptation and resilience. But as Nick has said, there's also another equally important task to this, okay? And that is to reduce our own impact. We use huge amounts of resources, we use huge amounts of plastics, produce vast amounts of waste, we use fossil fuel based energy, we have a big carbon footprint. And so the irony is, this is the health system, which is supposed to look after people, is in fact a major source of pollution. It's contributing to the climate crisis, which is harming human health. Okay? And that is completely inconsistent with our core business and completely inconsistent with the values of most health professionals. Okay? And so if you pull all that together, you think we have experienced disruption over the past 2 years. It's just a warm up for what is to come. Okay, so then the key point, we have two key tasks. Mitigate, we need to get to net zero. Every sector, transport, energy, education, everyone's going to have to get to net zero. We have a particular responsibility and indeed opportunity to do that. Okay? And also adaptation and resilience. I'm going to talk more about mitigation today, but these two key tasks are equally important. And indeed, as you can see in that diagram there is a lot of overlap between the two. Okay, so net zero, how do you get to a net zero health system? If you're going to do that, the first thing you need to do is understand your carbon footprint. We have done this research in New South Wales and indeed in Australia, but this is the NHS's carbon footprint. This is the most up-to-date and comprehensive analysis that I've seen. Okay, so you can see in the green section is travel, so there's patient, staff, and visitor travel. It's about 10% of our footprint. Okay. The red section is about the direct delivery of care. So you can see there the usual suspects: fleet and business travel, water and waste, and building energy, but also anaesthetic gases and MDIs, metered dose inhalers. There are specific carbon hotspots that we're going to have to look at. And then, of course, the key point is the big blue section, the supply chain. More than 60% of our carbon footprint is the stuff that we buy and use every day. It's pharmaceuticals and chemicals, medical devices, equipment, right down to food and furniture. So if we're going to get to a net zero health system, we're going to need to tackle all of these things. So what are we doing? In Northern Sydney Local Health District, where I work, we now have a board-approved target of net zero by 2035. We have a Planetary Health Committee, which is chaired by our Chief Executive and which has a number of members of our senior leadership team. Okay? And we have a Planetary Health Framework. You can see there with those 5 priority domains. And basically, we've sort of carved up the tasks. So our Director of Capital Works, who's a very keen engineer, is the Planetary Health lead on buildings and energy. Okay? Our Director of Health Promotion is the lead on people and places. So that's looking at greening our campuses and active transport and so on. And I'm most involved in models of care, which of course impacts on procurement and also on waste as well. And in models of care, we're in the process of setting up net zero teams. Okay? So eventually we're going to have net zero teams in every service, in every specialty, but we're starting with respiratory and anaesthetics because they're 2 big carbon hotspots. Okay? So net zero team is comprised of a multidisciplinary team, so nurses, doctors, allied health professionals, pharmacists, and whatever, at all different levels of seniority, so from consultants down to students. Small team, probably 10 or 15 people, partnered up with researchers, and the task of that team is, okay, net zero anaesthetics by 2035, and all the projects need to be aligned with that. That's our task. I'd just like to note that my role, of course, is across primary care and tertiary care. The Sydney North Health Network, the primary health network in our region, is the first in the country to have a climate and health strategy. So it's a terrific partnership between our 2 organisations in this key role. Okay, so a couple of slides. We need to do energy. This is Hornsby Ku-ring-gai Hospital. It's one of our solar projects. We also have one at Mona Vale Hospital. Clearly we need to do a lot more. This is a good starting point, but there's a lot more to do. And this is the sort of direction in which we need to head. This is the new Women's and Children's Hospital in Adelaide. We're the first 100% all-electric hospital in the country with no gas, actually. And then on transport, again, we need electric vehicles in our fleets. We need charging stations. We need electric sort of public transport, but also this focus on the co-benefits, things that have health and environmental benefits. And walking and cycling is a key one. Physical activity, of course, has a whole range of health benefits. So these are win-win situations. Okay, so then to models of care. So in our net zero teams, these are the 4 key principles that will guide their approach. And this is from the CSH in Oxford, the 4 principles of sustainable healthcare. And the first one is prevention. And that's because one type of carbon neutral system would be a system in which we didn't have any patients. Everyone was healthy and well and independent in their homes and in their communities. The second one is patient self-care. So that's about more informed and engaged patients, and also other models, peer-to-peer models, link workers, compassionate communities, social prescribing, that sort of thing rolls into that. So 1 and 2, keep people healthy and well and independent. The third principle is about minimising wasteful activities. And that's not just rubbish bin waste, that's clinical waste. So we know that overdiagnosis and overtreatment has significant harms and risks for patients, and also costs. Those costs are not just financial, but also carbon costs. Okay? The next step we need to do is reduce unnecessary overdiagnosis and overtreat. And then the final principle is, okay, where we do have effective evidence-based care, how do we decarbonise that? How do we choose the lowest carbon alternative? Okay? So these are the 4 principles that will be guiding our net zero teams in their approach. Okay, and this is a paper that we published a couple of weeks ago in the Medical Journal of Australia. And it takes there, on the left, the pie chart there is the Australian the Australian health system's carbon footprint. And so you can see it's divided up such that building it in electricity, gas overall is about 20%, but clinical care is the majority, it's about 80%. And then you take that 80%, shift it to the right. We know that from Wiser Healthcare's work and from the literature that 10% of clinical care is harmful care. That is, a patient goes for an unnecessary test or an unnecessary procedure, and they actually have a bad outcome from that. That is harmful care. The 10% is harmful care, 30% is low value care. That's overdiagnosis and overtreatment. So as you can see there, we are currently wasting more than 10 million tonnes of CO2e, carbon dioxide equivalent, on harmful or low value care. So we need to quickly reduce that. And then you can see this in practice now. So a lot of Wiser Healthcare has fed into things like the Choosing Wisely recommendations. So in this example, the Australasian College of Emergency Medicine has put together 5 or 6 recommendations, about evidence-based care and things not to do. So you can see there, those that, the do not do lists are displayed there in some Queensland emergency departments to remind clinicians about them. So this is a sustainability initiative. And then just telehealth, to mention that we need to think about innovative ways of delivering healthcare. In our district last year, we saved more than 500,000 kilometres of car journeys, which is more than 100,000 kilograms of greenhouse gases by using telehealth. So telehealth is going to be most likely an important part of our net zero shift. And then on to carbon costing. Okay? So in the future, carbon will be as important as money. It will be like a whole new currency. And health professionals will have to understand carbon costs of different investigations and procedures. So this is a paper published in the MJA last year. It showed for the first time the carbon footprint of the 5 most common hospital pathology tests. There is now literature on everything from the carbon costs of cataract surgery to the carbon cost of different forms of childbirth, to the carbon cost of different reflux treatments. Okay? This increasingly is going to be an important evidence base for clinicians to incorporate into their decision making. And then, as I mentioned, there's some specific carbon hotspots, and these are the things we're looking to tackle first. So the propellants used as, the hydrofluorocarbons used as propellants in meter-dose inhalers are very potent greenhouse gases. Okay? There are the disc type dry powder inhalers are much less environmentally damaging. So this is an area that our respiratory team is going to be looking at. And anesthetic gases are 5% of the hospital's carbon footprint. Okay? So this is something our anaesthetists are looking at, shifting gases, switching to TIVA, which is intravenous anesthesia where appropriate, and of course looking at plastics in theatre. Which brings me on to this point. We know that waste is a major concern to many of our staff and also to our community. We need to be looking at reducing the use of single-use plastics, but there will be some unavoidable plastics and we need better solutions for those. So in this example, this is St Vincent's Hospital in Sydney. They're recycling water and saline ampules and needle caps into new products. So you can see at the bottom there, the roller doors and pipes for plumbing and so on. Okay. So we're looking at a few different options at the moment with a view to starting a pilot next year. So these circular economy initiatives, these plastic recovery initiatives will be an important part of our program. And then this is sort of the final point, but a very important one. There are so many co-benefits in this space. Right? In health services, low carbon health services are very well aligned with more accessible, more innovative, more patient-centered care, and with reducing harms and risks to patients. And of course, more broadly, so many climate actions will have significant benefits for health. Will mean cleaner air, healthier diets, greener and cooler cities, more connected communities, and so on. So this is a very good and very important story. And who's best placed to tell that story? This is Ipsos Mori. It's a social research institute in the UK. And every year they rank from the most at the top down to the bottom, the least, most trusted professional groups in society. So you can see doctors do pretty well, 91%, but nurses are the winners. So health professionals are the most trusted and respected professional group in society. We have a huge amount of influence. in our workplaces, in our professional organisations, but also in our communities and with the media. And the climate crisis threatens our patients, our communities, and indeed our own families. And this is happening on our watch. So we have a big task ahead of us. We need to develop a low carbon, climate resilient health system, and we need to advocate for climate actions much more broadly as a health measure. And we have 10 years to do it. So we're going to need all hands on deck. Thank you.